Okay, ladies and gentlemen, thank you for your patience. It gives me great pleasure to open this webinar, Changing the Status Quo in Obesity, which represents the launch of the Obesity Policy Engagement Network, Open EU. So welcome to World Obesity Day, the European component of that on 4th March 2020. It gives us great pleasure to be launching the Obesity Policy Engagement Network on World Obesity Day. Before we start, I would like to give some very practical housekeeping information to help you participate most effectively in the webinar. So we will be taking questions after the presentations. If you would like to ask a question, you can raise your hand if you want to speak, and then make sure that your microphone is unmuted. When you raise your hand using the raise hand icon, the controllers will give you permission to speak, and then you will be able to ask your question. Alternatively, if you want to type a question instead, please do so through the written questions using the Q&A icon. We would also be able to answer your questions in the Q&A icon, so that's a second facility that you have available to you. So it gives me pleasure to welcome you. We will be welcoming and introducing ourselves. We will have opening addresses. We will introduce the call to action. My name is Ewan Woodward. I am the Executive Director of the European Association for the Study of Obesity. EASO is a federation of 34 and soon to be 36 national obesity societies from all over Europe, from Iceland in the west all the way down to Georgia. And so we represent all professionals and patients who have an interest in obesity, ranging from basic scientists through clinical professionals, public health professionals, and a very active patient community. So I would like to open the webinar by thanking the support of MEP Sant. MEP Sant was first elected to the European Parliament in 2014. He's from Malta, and the current mandate, he's a full member of the Committee on Economic and Monetary Affairs, the Petitions Committee, and the substitute for the Budgets Committee. MEP Sant has been a champion of addressing the obesity crisis throughout his time at the European Parliament, taking a special interest in the added societal benefits of treating obesity just as other chronic diseases. He has spearheaded actions within the European Parliament, which led in 2017 to obesity being made a priority also at the level of the Council of Ministers. So we very much like to thank MEP Sant for supporting this initiative, and I would like to show a welcome address to you now.
First, I would like to thank the European Organization for the Study of Obesity for organizing this event to mark European Obesity Day on the 4th of March. We all understand that right now there are various major concerns in the world of medicine, especially in the context of coronavirus making the headlines. Yet in such moments we should not disregard the major health risks. Currently, over 80 million Europeans are obese. From this Parliament, various actors have strongly promoted preventive measures to combat the onset of obesity. It is quite clear that a holistic and systemic approach needs to be adopted. We are to start sustainably stemming the tide of this real epidemic. For the numbers are extremely worrying. Scientific community is one voice about factors, biological, but also social and environmental, which cause obesity. The challenge primarily now lies in how society as a whole approaches the prevention, the onset, the treatment, and the long-term management of obesity problems. Solutions need to be carried out through the entire life of individuals. The success or otherwise will have a direct impact on the health outcomes of society as a whole. So, two aspects of the challenge have to be dealt with in tandem. First, the medical problem needs a medical response. Second, from a socio-economic perspective, education programs need to target specific strata of our societies. The social dimension of the obesity crisis is a crucial factor in its spread. The incidence of obesity proves to be higher within poorer strata of our societies. Vulnerable groups remain the most negatively affected. OECD research shows that social inequalities in overweight and obesity are strong, especially among women. Less educated women are 2 to 3 times more likely to be overweight than those with a higher level of education. But beyond the medical and social dimensions, at a macroeconomic level, the challenge we face is also financial. Current estimates show that obesity costs Europe about 70 billion euros every year in healthcare and in lost productivity. The total real burden is surely higher, as obesity causes many other diseases, including type 2 diabetes, cardiovascular disease, and certain cancers as well. Long-term and effective solutions to address the obesity crisis need to tackle the root causes of health inequities, as well as to provide the medical solutions where and as appropriate. So all structural factors need to be tackled. Seen from Brussels, the overall challenge needs to be wrapped up in the question: how shall we assist the different regional and the different national authorities to combat the disease by creating a new level strategy?
I would like to thank again MEP Sant for that extremely interesting presentation. He touched upon some extremely important issues, not least the gateway concept of obesity, social inequality, and some economic issues as well. We will have a chance to discuss some of those issues later in the webinar after we have presented the call to action for Open EU. But it now gives me great pleasure to also introduce some remarks from the Danish, it's from the Ambassador Per Fabricius Andersen, who is the Danish Deputy Ambassador to the EU. So we're extremely grateful for this support as well. In order to go beyond policy discussions and really embrace the economy of well-being, where health considerations touch all aspects of living, EU member states need to be at least open to collaborating and finding workable solutions. So it gives me great pleasure to play the presentation from Ambassador Andersen.
Welcome to the launch of the EU Obesity Policy Engagement Network. And a special thanks to MEP Mr. Alfred Sant for co-organizing this important event. We all understand precautions can be necessary in relation to the spread of COVID-19. And I had been looking forward to spending an evening with you tonight, but I am happy to still be able to welcome you to the event, although in this virtual format. So the format of this launch has been changed, but what has not been changed is the diversity and the sheer number of stakeholders that are engaged in this topic, and it reflects the interest and mounting momentum in this challenging issue. I hope this event can be a stepping stone in strengthening the approach to fight obesity in the European Union. The idea is to give you the opportunity to participate in a discussion on the approach to obesity and possible effects on policies and practices across all sectors of the European Union. We see governments and organizations around the world are turning their attention to the problems of obesity and setting ambitious targets for action. The UN Sustainable Development Goals set the target of reducing premature mortality from non-communicable diseases by 1/3 in 2030 through prevention and treatment. Reaching that target will be challenging. Unfortunately, it's even going in the wrong direction. We are seeing an increase in the number of people with non-communicable diseases. Severe obesity is the lifestyle factor that is the most associated with the development of multiple chronic diseases. This causes people to live with more than one chronic disease at the same time. However, the numbers in obesity are moving in the wrong direction. Prevalence of obesity globally has tripled since 1980, and on average, 1 in 6 adults are obese in Europe. In parts of the world, overweight affects more than 1/2 of the population, according to the World Obesity Federation. Obesity and overweight is estimated by the World Health Organization to currently drive between 2 and 7% of global healthcare spending, with a view to increase further. This is a serious challenge to governments and healthcare systems, including in Europe. Obesity has multiple possible causes, including nutrition, lifestyle, genetics, and food production methods. It requires holistic long-term management to avoid further complications such as type 2 diabetes, certain cancers, and respiratory disorders. If effective solutions are not found, obesity prevalence could increase in many countries across Europe, and more than 1 billion worldwide could be obese by 2030. It will require commitment and concerted efforts from governments, international and European institutions and organizations. We need an open debate on how to tackle this complex issue. Under the leadership of the former Finnish presidency, the Council adopted conclusions on the economy of well-being. The conclusions highlighted the close link between economic growth and human well-being. If citizens are healthy and feel well, then they are more likely to contribute to and to take active part in society. So we need a holistic approach to see that healthcare expenditures are also an investment in people and not only a cost. When it comes to obesity, investing in prevention and treatment could have a direct positive effect on the well-being of people, and thereby lead to economic gains in the healthcare system and in society more broadly. I hope today's event will mark the beginning of an increased focus on obesity in Europe. Thank you.
Thank you very much. I think some other points to consider in that presentation as well. And again, we thank the Ambassador for his contribution and for his presentation. It means a lot to all of the coalition members and people working in this field that such important partners are ready to help us. Now, I think we could all have enjoyed a launch reception at the European Parliament last evening, but circumstances sometimes are out with our control, and we are welcoming you to a webinar instead. The main point of the webinar really is to launch the OPEN, which is the Obesity Policy Engagement Network, the European region version of that. But we wanted to put that in some context before we launch officially, together with presenting the call to action. One of the first things we wanted to do was show you a presentation and welcome you to Dr. Abd Tirani, who is a member of the EASO Obesity Management Task Force. He's a clinician working in the United Kingdom with a rather large multidisciplinary obesity centre. But the nature of his work means that he's often quite busy and is currently tied up in clinic. So what we're going to do, if it's all right with Vicky Mooney, is we're going to ask Vicky to contribute just before Abd is able to join the call. We know that Vicky is available. Now, Vicky Mooney is the Executive Director of the ECPO, the European Coalition for People Living with Obesity. This is one of the most important partners of EASO because it represents people living with obesity across Europe. Now, we'd like Vicky to talk to us about why it's important to treat obesity with the same approach adopted for other chronic diseases. We need to break the stigma that sometimes causes this. So if Vicky is online, which I think she is, I'd like her, if possible, to address 3 simple but also quite challenging questions. And those questions that I would pose to Vicky are, what are the key challenges for people living with obesity? What policy changes would have the biggest impact for people living with obesity? And why is a multidisciplinary approach important? And just before we do that, I'm going to hand to my colleague, Cherie Bryant, who also works with the ECPO.
Hi, Ewan, can you hear me here?
Oh yes, this is Vicky. Hi, Vicky.
It is indeed.
Sorry, we had to put you on the spot a little bit there.
That's
Ab
okay.
was unfortunately held up in clinic, so we thought it would be all right if we asked you before Ab to contribute to the
No
webinar.
problem.
Would you like me to repeat those questions, or are you?
Not at all. No, I have them here, so thank you so much, and I really appreciate the opportunity for ECPO to play a part in this. As we've worked with you for many, many years in EASO, it's been paramount that the patient voice is heard, and I think at many times us as patients, we tended to feel probably like the elephant in the room or the token patient, but realizing the work that we've done and been a part of over the years with EASO has really made that come clear, that the patient voice is really key to what we're doing. So with regards to the challenges that we face, I suppose our greatest challenge is really accessing quality care, treatment and management for obesity. And not forgetting, of course, the comorbidities, such as Ab will mention and go through the likes of perhaps links to some cancers, cardiovascular disease, type 2 diabetes. So people may say, well, why can't you access the treatment? Why can't you just go to the doctor and get treatment for your obesity? And I think a lot of that comes back to the fact that obesity has been seen as a lifestyle choice. So we get the, eat less and move more, exercise more and don't eat as much, don't take as many calories in. But what people don't realize, and what ABD will show them, is that obesity is severely complex. The complexity of obesity is something that leads to a lot of the stigma, because unfortunately people don't know it's complex. When it comes to stigma, I suppose we're talking about stigmatizing language, we're talking about judgment from others. And as a patient, I suppose I'm speaking as somebody who has lived with obesity all my life. And for many people who are listening, if you don't live with obesity, if you can imagine, your parent, if they live with it, a child, if you have a child who has it, or a grandparent, a friend or a colleague, somebody who has obesity, and the challenges that are in place when we're seeking intervention or treatment are quite high, unfortunately. We're looking at stigmatizing language. We're looking at patients who, attend their GP clinic, and a lady goes in for a smear test, and unfortunately the bed will not support her weight, and therefore the test is done on the floor. We're talking about patients who are stigmatized or criticized for not losing enough weight, or attending a clinic and the blood pressure cuff not being big enough to actually take their blood pressure. And when patients go through this, not only are they stigmatized and judged for being the size that they are, the weight that they are, but they also internally stigmatize. And what we've seen is the likes of the Action.io study, which was fantastic in showing us that some patients actually wait up to 6 years to receive treatment. Now, when we say this is a challenge, it's a challenge because what we want is early intervention. We want people seeking early diagnosis. We want people actually getting some sort of intervention, because there are people out there who have literally been on a diet for all of their life without realizing that obesity is incredibly complex. So for us, the key is breaking down the stigma, having the conversation about obesity as a chronic and complex disease, being able to talk about getting treatment from a multidisciplinary team. When you mentioned there about the policy changes having the biggest impact for patients or people who live with obesity, I think it's good to point out that our chair, Ken Clare, actually did a great piece in the latest edition of the Parliament supplement, and in it he actually claims it's quite simple. So when we talk about policy changes, we're talking about treating obesity with the same adopted approach as other chronic diseases on an EU level from a policy perspective. So if we look at AIDS going back to the 80s, we're talking about intervention. we're talking about acceptance of obesity as a chronic disease. We're talking about breaking down the boundaries and ensuring that there's infrastructures, incentives, and sanctions that are put in place and to ensure on a national, regional, and EU level as appropriate beyond the conventional health policies. And as I was listening to MEP Alfred Sant, as he said, a new EU policy, an EU strategy is vital. It truly is. Your last question, I think, I'm just going to briefly touch on, because I think when Abd Tarani comes on and gives his presentation, it will really show why we need a multidisciplinary approach. Obesity is severely complex, and we know this. It's multifactorial. I know myself, being a patient going through the system, I needed everything from my psychologist to a dietitian, an endocrinologist. I needed to ensure that I had somebody who could help me with my movement. So these are all aspects that people don't consider. So obesity is so much more than eat less and move more. We need to break the stigma. We need to adopt people first language, which has been adopted for all other chronic diseases. So we need to start talking about people who live with obesity and not obese people. Thank you, Ewan.
Thank you, Vicky. That was a powerful presentation, as always. It gives us an opportunity to actually open the floor to some questions. So we have a large number of people involved in the webinar. Hopefully they will have been inspired by your presentation and maybe intrigued by your presentation. So I wonder, there might be some questions coming in on the Q&A chat as well, which we will check in a second. But if anybody would like to ask a question at the moment, please raise your hand. I may have one or two questions. I might sneak the opportunity as chair to ask a question, but I see that there may be some questions coming in on the Q&A. So I'm going to open a question for you, Vicky, and that you mentioned that MEP Sant had presented the need for a new EU strategy, saying how vital that is. Now, as somebody who's representing a patient community within Europe, what do you think might be the biggest barriers to the implementation of such a strategy? As a patient representative, do you see anything that's perhaps a bigger barrier than other things?
I do, yeah. I think what we're looking at is no understanding of the complexity of obesity, right? So this is where I'd like to take the likes of Abd Tarani in his presentation and share this with every MEP, every MP, everybody who works on a policy level, because until they actually understand and see the complexity of obesity, well then how are we going to change their viewpoint? So education is key to all of this, really. And I think as well, from a patient perspective, and one thing I loved about what Ken Clare said in the article in the parliamentary supplement is he hears people saying things like, you know, we need a paradigm shift. And he says, yes, I think we do, because we need a paradigm shift towards using language that patients understand. So we also need engagement on a policy level where patients can engage without this breakdown of language and miscommunication. So we need education, and we need to be able to have that patient voice heard on a policy field.
Thanks, Vicky. I think that resonates with quite a lot of what we might present when we launch Open EU and when we present the call to action. So we will have a chance to have further discussion on those topics later on in the webinar. Now, I understand that Abd has now been able to join us. He was obviously dealing with a very complex clinical case, but he is with us now. So Abd Tarani, he is a professor at the University of Birmingham, working as a clinical scientist, running a multidisciplinary treatment centre for obesity. And he's going to talk to us about what is obesity and why do we need this new approach. So Abd, could you raise your hand so that we can identify? If you click the icon, the raise hand icon at the bottom of your screen, that will allow us to permit you to talk, and then you will be able to address the webinar.
Hello?
Abd, I'm glad to hear your voice.
Excellent.
It gives me great pleasure to welcome you to the webinar. And I would like to pass the floor, the virtual floor, to you to really tell us about what is obesity.
Thank you very much for the kind introduction, Ewan. And it was great to hear what Vicky has said. I joined halfway through her talk. So if we look at what happened over the last few decades, all what we can see is that obesity prevalence is increasing globally. Hence, we must be doing something not right or something fundamentally wrong in our current approach so that obesity just keep increasing despite everything we are doing. So what we are doing is not right. And I think part of the problem with the current approach we have is that we focus a lot on the individual person. We focus on the person with obesity. We somehow expect them to treat themselves. And that is simple, isn't it? It's because they just need to eat less and move more, but simply is not working. Now, if it is not working for 1 or 2 individuals or 5 or 10 or 20% of people with obesity, then okay, it may be their personal fault. But when it's something not working for 80% plus of the population of people with obesity, then this cannot be just simply a moral issue or a lack of willpower issue. This must be related to the fact that we are using probably the wrong treatment and wrong strategy to address this increasing prevalence of obesity. So what is it that we can do differently, and why obesity approach as eat less, move more is just simply not the right approach? Well, it's not the right approach because it doesn't actually fit with the pathogenesis of the disease. So the reason why we have obesity comes down to 2 simple mechanisms, 2 basic mechanisms. It's a lot more complex than 2, but to simplify it, we have imbalance between energy intake and energy expenditure. And because of our lack of understanding or our lack of clear understanding of the mechanisms that drive this imbalance between energy intake and energy expenditure, we came up with these very simplistic approaches of eat less and move more to adjust this imbalance, but that doesn't take into account at all what's the reason, the underlying reason for this imbalance between energy intake and expenditure. And the other important mechanism that contribute to obesity is the higher body set point or the body weight set point, which basically means that the body will defend its weight at a higher value than the normal value. And that means that weight loss is difficult, but even when weight loss is achieved, maintaining the weight loss becomes even more challenging. And even the lack of maintenance of weight loss, which is usually the rule in terms of weight loss interventions, is actually driven by biology. It has nothing to do with people choices. And I'll explain the mechanisms related to that as we talk along in this small presentation. So what actually drives the imbalance in energy expenditure? What drives this imbalance between the 2? Well, the Foresight project looked at the factors that contribute to the imbalance between energy intake and energy expenditure and identified hundreds of possible factors. They've put them together in a complex map called the obesity map, and also implicated the interactions between, illustrated the interactions between these multiple factors. All these factors have an impact on our decisions in terms of energy intake and energy expenditure. Some of these factors are biological driven, some of them are environmental, related to the built environment, for example, or related to socioeconomics, or related to the food industry, or the media. So there are a variety of factors that affect the individual decision in terms of what they eat and how much energy they consume. But this is a lot of it is driven by biology, as I will show, that most of the weight is actually genetically controlled. So when we talk about obesity as a disease, people will ask, okay, a disease should have an impairment.
I think we might have a technical issue there. We seem to have lost Abd for a second. Abd, are you still there? We're just going to check at the control level if we can If we can reconnect with Abd, he seems to have dropped out.
Diseases that are associated with obesity is quite extensive, including cardiovascular disease, type 2 diabetes, cancer, and death, and increased risk of mortality. So let's look at what can control people weight. And if we look at all the genes that are related to obesity, we find that most of them are actually related to the central nervous system. And that is not surprising, considering that our energy homeostasis center is actually in the brain. So the brain is where we decide the balance between energy intake and expenditure, and most genes related to obesity actually affect the central nervous system. But it's not that only there are genes that can result in obesity, there are also actually genes can result in thinness. And I think the understanding the interaction between the genetic factor and the environmental factor is absolutely essential to understand why obesity is a disease. So most of the studies showed that the vast majority of the weight is genetically controlled. And what I mean by the vast majority of the weight, we are talking around 70 to 80% of people weight is actually controlled by their genes. That means 20 to 30% is controlled by the environment. So the genes can determine whether you are going to be heavier than someone else. But the environmental factors can also determine how heavy you are going to be above a certain point. So it's very important that we understand that this is a disease that is modified by the environmental factors. So it's very important to treat the biology, but also it's very important to change the environmental factors in order to achieve maximum efficacy treatment effect, and also in order to prevent the disease or prevent obesity from developing and reduce the prevalence of obesity over time. And there is now multiple studies that showed that depending on how many genes related to obesity you have an increased risk of weight gain, and you have increased risk of developing severe obesity. We also know that, again, depending on the number of genes related of obesity you have, or the number of gene variants related to obesity you have, that will determine how much weight you can lose with interventions, and your ability to maintain that weight loss also seems to be related to these genetic factors. To explain a little bit more about this interaction between the gene and environment, I'll give an example. There was one study which looked at the FTO gene, and this is one of the genes related to obesity. And if you have the FTO gene, you'll be heavier than someone else who doesn't have the FTO gene. But if you have the FTO gene and you are physically active, you are lighter than someone who have the FTO gene who is physically inactive. However, if you have the FTO gene and you are physically active, you are still actually heavier than someone who have the FTO gene but physically inactive. And sadly, because of our prejudiced views, we will look at this person who is heavier, who is actually very physically active, but heavier because they have the FTO gene. We look at them and say they must be lazy. While we look at the person who doesn't have the FTO gene, who doesn't have the FTO gene, but they are physically inactive, we think they are okay because they are just thinner. And that comes from our prejudice, while the biology suggests that that person who is heavier because of their genes, and actually they work very hard with physical activity to reduce the impact of obesity and try to reduce their weight. And there are multiple studies in the literature. Even our body responses to sugary drinks, in one large study published in New England Journal of Medicine in 2012, showed that our body responses to sugary drinks and the amount of weight gained or not gained is actually related to the number of genes related to obesity that we have. Even our responses to diet seems to vary according to our genes. So for some people, genetic background, the high-fat diet is better than the low-fat diet. For others, it's the opposite. And then when we have the patient not responding to the diet, instead of thinking that this is biologically driven, we think, oh, they must be not adherent. When in fact, it may be nothing to do with their adherence. Maybe we are giving them the wrong diet for their body metabolism. Similarly, there are many other factors contribute to obesity, which is outside the control of the person's own wills. For example, maternal programming. So while we are in the uterus, has been shown that the heavier the woman at the time of pregnancy, and the heavier the weight gain during pregnancy in the woman, the more likely that there is higher weight gain in the offspring in their 30s, 20s and 30s. So when we blame people for their excess weight, we seem to not take into account at all how many other factors at play here, which are completely out of their control, whether it's biological, genetic, or whether it's related to maternal programming. And we don't seem also to understand the context. For example, the impact of the socio-demographics, socio-economics, and the impact of other players such as the media and the food industry. When we talk about weight regain, I just, because I know I'm over my 10 minutes and I need to finish quickly, just quickly to say, when people lose weight, hormones changes in the body. And this has been shown in multiple studies. When we lose about 5 to 10% of our weight, our body reacts by increasing the hunger hormone, reducing the satiety hormone, and even worse than that, it reduces the energy expenditure. So the end result of all of this and the outcome of this, that people will feel more hungry, less satisfied with food, so they will eat more. And because they are spending energy expenditure, then their weight regain occur. And we know from data in the UK, for example, that if you lose 5% of your weight, 80% of people will regain that weight over 5 years. And this weight regain is driven by those biological mechanisms and nothing to do with their willpower. And what is interesting, even after the weight is regained, this lack of energy expenditure actually persists for 6 years at least after the weight regain, as we know from the Big Loser program in the US. So this is all biology driven and nothing to do with the people willpower. But that's why using pharmacotherapy, for example, or long-term interventions or bariatric surgery work work as in the sense of resulting in sustained long-term weight loss. It's because it actually addresses these biological mechanisms which are related to the weight regain. And that's why it is also important that while we are talking about obesity, we need to recognize that as any other chronic disease, it requires lifelong treatment and lifelong support. The treatment and support and the nature of this treatment and support might vary according to the stage and severity of the disease, but lifelong treatment and support is required for the vast majority of people. But we also have we should not forget that we need to change the system, the whole system around the people with obesity, whether it is addressing health inequalities or addressing the media or the food industry or the built environment. This is also an essential component in terms of helping people who lose weight to maintain their weight and stop people who are not obese, who do not have obesity at the moment, to develop obesity further. So just to summarize, the reason why we have obesity at the moment is because we have the people who develop obesity are the people who are biologically designed to conserve energy, and we put them in the wrong environment. And this interaction between their biology and the environment, which results in obesity. So if we treat obesity as a chronic disease, then we will understand the mechanism and pathogenesis better. We will stop blaming people for their excess weight, and we can understand it's nothing to do with willpower or moral fiber. And then we can avoid the obesity stigma, which have major impact on health, as well as on the care delivered to people with obesity. And then we stop setting up the patient for multiple cycles of failure by just trying diet and exercise again and again, when that's the wrong approach. And it helps us provide long-term support to people as if we treat hypertension, similar to how we treat type 2 diabetes. We provide lifelong chronic support because they have chronic diseases, improving treatment access, and also implementing a whole system approach in order to prevent the disease. So I think it's really time to change the narrative about obesity. Eat less, move more does not work. We need to recognize obesity as a chronic disease requiring lifelong support and address the environmental and biological factors simultaneously, improve treatment access, and challenge and eliminate the stigma. And thank you very much for your time.
Thank you, Ab. That was really fascinating, and I hope that was a presentation that resonated with the participants of the webinar. I think you really highlighted that obesity is controlled by complex biological systems, but is also affected by an exposome system and many other factors. Now, we will have time for question and answers at the end, so I'm not going to open your session for Q&A right now, because I think your presentation and also the presentation by Vicky has really highlighted a major need, which is why we have decided to come together to develop Open and to launch Open in the European region, and to launch Open in the European region with a very specific call to action. So I would like to take some time now to present Open and to present that call to action, and then we will have a Q&A session where people can ask about Open, about the pillars and recommendations, and they have the opportunity to ask both Abd and Vicky questions about their presentations. I know that I have some questions to ask Abd, but I would leave the floor to others before I do. So I will move on and talk to you about the Obesity Policy Engagement Network. What is it? Well, it's a network, it's a sustained global initiative aiming to achieve national policy changes in support of improved obesity care. So members are provided with the opportunity to discuss progress in their country, to gain insight and inspiration from other countries and experts, as well as obtain tangible tools to further evolve national obesity strategies. So ultimately, we're trying to improve national obesity strategies, improve the care for people living with obesity, improve the capacity of people treating obesity, people preventing obesity. So we bring together obesity experts and policy advocates with multidisciplinary perspectives to discuss obesity solutions. We support national coalitions in their efforts to improve care, and we provide a sustained platform to enable best practice sharing and solutions for the most effective obesity management possible. You can see the partner organizations represent the leading scientific and medical organizations globally and regionally. Now, what are we doing then in the EU? So we want to work together to implement a cross-cutting policy approach at an EU level. We feel that there's really a need to do that at this regional level, which seeks to ensure that all relevant European institutional strategies and policies integrate measures that effectively help support people living with obesity. I think that was resonated by what Vicky said, but also by what Abd presented, and I think also came through in the presentation by MEP Sant. What is the approach? Well, who is the coalition? It's key experts in policy and decision makers covering a wide range of areas. Why do we do it? Well, we do it more or less the same reasons for the Global Open Initiative, to ensure European countries are empowered to create healthy environments and to provide people living with obesity access to fair, effective obesity treatment and long-term management. And we do that as the European Commission shifts towards a mission-oriented approach to policy portfolios. EU institutions are uniquely placed to make a positive contribution as a community. And when, well, with 4 coalitions at a national level across the EU, the time is right to act at the EU level now. We really feel that we're ready to work in a coalition setting, to work together towards this common approach and this common goal. And the journey so far is that many partners have been involved in the process of co-creating the call to action and the core recommendations, which I will present in a sec. Some of them are listed here, but a lot of the work is now presented in the most recent supplement of Parliament magazine. It's available via the Parliament website already, but we will share it with all participants. And in fact, a major part of the supplement is an outline of the call to action and the recommendations. So the call to action for Open EU comes with 4 critical focus areas. The first of this is that we really want to obtain governmental, health system, and public recognition that obesity is a chronic relapsing disease, ensuring that we move from individual to shared responsibility. And I think a lot of what Abd presented talks to that particular critical focus. Now, what is the call to action there? Well, we want the European Commission to adopt obesity as the next health mission, with a view to guiding the process of establishing cross-sectoral national plans for the prevention, primary, secondary and tertiary, treatment and long-term management of obesity, as is the case for other chronic relapsing diseases. We want an outcome-related obesity target should be firmly embedded as part of the measurement criteria of a healthy economy in the European semester process. We want to reframe the public perception and understanding of obesity as a chronic relapsing disease, rather than a lifestyle choice. we have critical focus area 2, which is to review and optimize allocation of healthcare resources to secure funding for care. And the call to action in this focus area are, we want a comprehensive mapping that should be undertaken to establish the link between treatment of obesity and prevention of other major chronic diseases, to identify and cross-fertilize evidence into the value of innovative obesity treatment and management strategies, focusing on health outcomes at societal rather than an individual level, to have a multi-stakeholder collaboration that is urgently needed to map treatment gaps for people living with obesity, as well as tertiary prevention of other chronic diseases, to develop EU blueprint on obesity prevention, diagnosis, treatment and long-term management at population, treatment infrastructure and reimbursement levels. I think that's extremely highly relevant and required. Then we have focus area 3, which is to integrate obesity into learning curricula across all relevant professions to support more effective, informed care. And the call to action would be that we want to conduct a gap analysis of existing obesity-related education and training curricula to fully understand where improvement is most urgently needed. To ensure obesity is integrated into all relevant education curricula across EU member states, especially in undergraduate health professional education. And to ensure capacity building on obesity health literacy is firmly embedded in all stakeholder interactions. To undertake real-world evidence study to assess effectiveness of a multidisciplinary approach. And finally, critical focus area 4 is to establish and support multidisciplinary centres for the treatment of obesity and ensure access to transdisciplinary care for those people with obesity. The call to action being to upscale and broaden the remit for multidisciplinary obesity treatment centres. And the new approach to obesity should be embedded into the EU health data space, as well as a standardised international patient summary. Now, those are very clear critical focus areas with clear calls to action underneath each of those, but they probably need to have some discussion around them, and they probably need to have some explanation as to how the co-creation coalition came to prioritise those issues. So I would like to open the floor to my colleague Jacqueline Bowman, who is the policy lead at EASO and who has been instrumental in the development of this call to action, but also in the development of the whole Open EU coalition. And I would like Jacqueline, if she could, to talk to the webinar about how this process happened. Why were those priorities chosen and selected by this wide-ranging coalition, and what impact can we expect to see from these focus areas and from the topics that we have identified and prioritized in the calls to action? So I now open the floor to Jacqueline, who is now being permitted to speak.
Thank you very much, Ewan. I'm guessing I'm loud and clear for everybody. Yep. Yep, great. Okay. Well, actually, I'd like to take the final question first, which is about impact. Because in days gone by, I think we were all quite guilty of it within the policy-making community, that we looked at things which are quite abstract, went through a particular process and said, well, this must work, and it will be top-down, and it's what we think it will be based on XYZ studies, and that's fine. However, what has come to light, as numerous of our colleagues have said already today, the fact is that if you don't know what your end game is, what's your desired impact, it's very difficult to make policies that are actually effective and are taken up at all levels in order to make a difference. And so I would say very clearly that the impacts that we want to be able to make, and we think that we're in good shape to make that happen between now and 2030 to contribute to the Sustainable Development Goals as well, is that we want to see effective stemming of the obesity crisis. but very much so taking into account all who can be at risk of ending up with obesity, of the onset and then disease progression of obesity, those who are already living with obesity, and those who are at risk of the other complications, including in light of the recently announced Beat Cancer Plan, 15% of preventable cancers there is a direct correlation with obesity, and another 230 other disorders to boot. So the impact is stem both the tide of obesity and preferably prevent a number of those 230 other disorders, and make sure that there's a system that actually supports that, which means that there will be equal access to healthcare in a non-discriminatory manner, so to enable treatments, effective treatments, to move forwards. So how did we get to that? Sorry, allergy is not the obvious. How did we get to that? Well, actually, we looked at what was going on at Open Global with these 4 areas, and we did an extensive policy and situational analysis and review. We also talked with a lot of stakeholders in different sectors, so not just the usual suspects within the Brussels bubble, but we really wanted to understand, if we want that end game, who should actually be involved. And what it culminated in was actually an interactive workshop, and you see the list of 20 or so organizations who were present, which was participatory engagement methodologies used in order to come up with these prioritized areas and then specific call to actions, which in the drafting process we then mapped to ongoing or upcoming initiatives at policy levels that we could easily be aligned with. So of course a no-brainer was we want to be in line in the next round of missions for the European Union, and of course we see that now with the Beating Cancer Plan, in that it started off within research and innovation in terms of the mission to beat cancer, and now we're coming through to the other commission services and policy areas to say, how can we tackle beating cancer? We'd like to see exactly the same thing for obesity, because that would actually focus everyone's minds into addressing the question at hand, instead of continuing in this ineffectual silo environment. In fact, over 30 different organizations contributed their input into what you have as the manifesto. And I think, you know, why are we doing it in this way? Very long story short, it's because just as obesity, the onset of obesity, you may be able to put it into 6 buckets, mostly biological, but some could be psychological, or certain types of drugs will make you gain weight, or environmental, such as lack of sleep. But actually, as Ad said very eloquently, regardless of how the obesity starts or the onset, when that person is in an environment, and that's not only their physical or human exposome environment, it could actually be their work environment, which plays on stress. It could be access to work. It could be that they are an informal carer, and so they have the stress of all of that. All of these different elements, which are both internal and external to us, which can have an impact. So if we don't have a realistic idea of this and work across all possible sectors and stakeholder profiles who can positively impact on the health outcomes for those living or at risk of with obesity, then I think it would be just another futile task. So that's why we're doing it, how we're doing it. There's so much detail in the manifesto, which, as I say, aligns us with ongoing and upcoming EU policy initiatives. But in conclusion, I would say that what we need to take into account is that regions are going to be key to this. Health professionals across the various obesity-related conditions, diseases, disorders are going to be key to this. Patients and people and citizens living with obesity are equal partners at this table, because actually they know themselves the best. So it's just a matter of getting from everyone what they already know exists. Digital as an underpinning factor in terms of big data, harnessing data, GDPR, is also going to play a very large role. And some of the unsuspecting protagonists as well will maybe be people or organizations within the retail sector as well, because this is about supply and demand. How do you actually manage, or how does the system help you to manage living with obesity? Over to you, Ewan.
Thanks, Jacqueline. I think that was very comprehensive. We can now certainly well understand the process, the wide range of stakeholders who were involved and who will continue to be involved in the open network as the initiative develops over the coming months and years, with that ultimate aim of helping people with obesity and undertaking policy initiatives across a number of different focus areas and recommendations. Now, we don't have a huge amount of time left, but I'm sure people won't mind if we run over by a couple of minutes if there are some interesting Q&As. Now, we have already started receiving some Q&As via the system, and I'm going to ask Jacqueline to keep her microphone open, but I'd also like to bring in Vicky and perhaps Abd and even Luca Bussetto if he's still there, because the first question we have relates to the environment and the fact that in the four focus areas and the recommendations, we don't specifically talk about addressing the obesogenic environment directly. Now, of course, we always think about a whole systems approach, but the open manifesto call to action is looking at perhaps other areas and not specifically mentioning the fact that we can not change our genes, but we have an opportunity to change the environment. What would the participants in open react? How would you react to that, Jacqueline, Abd, Vicky? And if you are ready to answer that question, could you raise your hand? I think I can see, Jacqueline, your hand is already raised, but I think if we can open this one here, and I would ask you to, if you could address that question.
Yeah, okay, so I think that is actually really interesting. Sorry. Really interesting code for the big push at EU level, which has been for the last, I would say, couple of decades, to only look at the obesogenic environment without actually completing the picture of, as Ab said, what is biologically going on in the first place within any given individual. So I think that when we look at it from a systems perspective, and more specifically, we do very clearly talk about outcomes-based healthcare. So when you talk about someone's health outcome, you actually do have to delve into not only the biology, but also how they interact with the various external environments around them. So yes, the conventional discourse on the upcoming farm to fork policy will be under discussion, I have no doubt, but it won't be in terms of food policy per se. It will more likely be part of the, how does the human exposome, so endocrine disruptors, other chemicals, clean water, whatever it happens to be, how do those actually affect your biology, and how do those affect your genes, as opposed to talking about sugar tax for the sake of talking about sugar tax, because as Ab said, it's very clear this is not about willpower.
Can I add something, Ewan?
Yes, please. I think it's important to get some different perspectives. So yes, please, Ab.
So, thank you for the question, and I totally agree that at the end of the day, the debate is, we can't change the genes, so why don't we focus on the environment? So first of all, I would like to say we do need to focus on the environment. It should be a system-wide approach, but we can do something about the genes because we can offer people better treatment access. Pharmacotherapy and bariatric surgery, for example, as well as intensive behavioral therapy can work. Obviously, the efficacy is different between these three. So the effect sizes is different, but they all work to a certain degree. So we can improve treatment access. I may not be able to change the gene, but I can treat what's the outcome, and I can treat the what's happening down the line because of the genetic background. Also, I think it's important to say, while I may not be able to change the gene itself, don't forget about what I mentioned about maternal programming. So actually, by changing the metabolic environment in the mother, I can affect the outcome in the offspring, including epigenetic changes and changes in genetic expression. So there's lots of things we can do by addressing the obesity in the parents, by offering better treatment strategies, as well as addressing the environment, and hence we can have a major impact. If we only address the environment, especially if we address only one aspect of the environment, is probably is not going to work, because we will need a system-wide approach. And I'll give a very quick example. In the US, the consumption of sugar is actually going down, but the obesity prevalence is not going down. So just because one thing is being addressed doesn't mean that somehow the whole thing will get better. We really need to work at all the key players that contribute to the development of obesity.
Thanks, Ab. Would anybody else like to contribute to the answer, or shall we move on to another question, because we have a few more? Very good. I think this is quite a practical question, and I'd just like to say, just before I ask this question, we have received a number of questions that are really very long and take us a while to read and digest as we're going through the webinar. We will follow up directly with anyone who has asked a question if they're not already happy with the answer that has been given by those on the webinar. So if we don't get a chance to answer your question directly now, we will be following up directly with you, because the whole concept of this process is that it is co-creative and coalition by nature. So we want to hear from you, and we will communicate with you after this webinar. So I move on to another question, which is from a national patient organisation, and it's quite a simple but practical question. So what is the next step for Open EU, and how might patient organisations in different countries help out? Now, I know from my own involvement in Open EU that we are developing from the call to action a coherent strategic action plan, which will involve many, if not all, of the members of the coalition being involved in various different activities and initiatives aimed at meeting those focus areas, meeting those recommendations. But we should also understand that this is a co-creative process, and this is the starting point. So we will be continuously discussing input and recommendations from new and existing members of the coalition. But I'd like to also hand this to other members of the webinar, because I know that Jacqueline in particular has been discussing this very issue with a number of the members of the coalition. So Jacqueline, if you could, I don't know if you've put your hand down yet, but if you could put your hand up again, perhaps you can talk to this as well.
Yep, my hand is up.
And we can hear you loud and clear. Thank you.
Okay, so yes, absolutely. I mean, this is a work in progress. The 30-odd organisations have put in a lot of work, as we know already, into getting our overarching objectives. However, the call to action is absolutely open to others, sorry, at national, regional, trans-border level to endorsing and supporting, and we actually have a very specific governance structure in place as well to ensure that everyone has an equal voice and that contributions to realizing our ambitions collectively are actually manageable, because not everybody has a big team of 50 people. Some of us are sat on our own, you know, day to day. So it's about, as Ewan says, that collaborative effort. Now, in terms of national patient organisations, dare I say it, but we're in open as a network, is already in 4 European member states. And why not actually get going on others if you're not in one of the 4 member states who are active already? The Global Secretariat, who certainly we've worked with closely in order to get this launch up and running, I'm pretty certain would be able to give some advice. And of course, my door, virtual or physical, is always open to say how to do it, because we did follow a particular process, as we said, to make sure that everybody actually can have their voice heard and that we come out with something which is a shared value. So there's a win in it for everyone who is part of the collaborative effort.
Thanks, Jacqueline. And I would also point out that the European Coalition for People Living with Obesity has the ambition to support established, developed patient organisations in all EU and European countries. And EASO ourselves support initiatives in many European countries as well. And as we are here celebrating World Obesity Day, we've supported a number of initiatives in, I think, as many as 12 different countries. And therefore, that's also an opportunity for patient organisations at the national level to get more involved. And please contact us after the webinar so that we might be able to discuss those issues further. Now, there's another question which is related to data, and really, without reading out the question, because it's quite long, but it's, I think, and correct me, Steve, if I'm wrong, but essentially you're saying, or at least what you read in the current version of the call to action, is that we're not really going far enough with data. We're not looking forward enough. And I think that may be not reflected in the call to action wording, but certainly it's something that's very high on the thinking of the open networks, both globally and regionally, and it's certainly something that we're involved with at the EASO level. Now, that may not be a very complex answer for you, but yours is one of the questions which we will be happy to follow up with more directly after the webinar. If you would like to respond to what I've just said, which, as I appreciate, is not so detailed, feel free to put your hand up. But I also see that Jacqueline, who has been doing some work in this data space, would like to comment as well. So we'll bring you in. But Steve, if you're still on the call, and I don't see your name there anymore, but please do raise your hand if you would like to respond to that verbally. Over to you, Jacqueline, if you would like to also comment on that.
Yeah, sure. I mean, I think we need to bear in mind as well that we're at EU level, and so we were trying to map initiatives that we could leverage at this point. So obviously it's going to be implementation of GDPR, it's going to be the European Health Data Space, and a few other interesting pieces coming online. But what it boils down to is that we need to make sure that we have a joined up approach to data gathering, collection, harnessing, and leveraging. it's as basic as that. To actually speak and collaborate with others who are deeper into this space, as you say, Ewan, we would be delighted to have that discussion, to see what more we can be doing, always taking into account that it needs to be in order to give that digital underpinning, as it were, to reach our ultimate goal.
Thanks, Jacqueline. I think we have now run quite far over time. I'm just checking if further questions have come in. And they are related. So I'll read the questions out, and if you don't mind, I shall respond to them directly, because I think we probably need to wind up in the next couple of minutes. But the first question would be, do you plan to work with startups that have had good results in childhood obesity? Obesity in childhood is something that's very important to EASO, to ECPO, and I'm quite sure to most, if not all, of the coalition partners. We have, I think, highlighted that open as a network is not just an acronym, but it's open as well. And so we would be willing to discuss, collaborate with organizations that are active in this field, and particularly those that do have some levels of success, whether that's in a prevention, treatment, awareness capacity. So yes, we will reach out to you after the webinar to start discussions. So that's an answer to one. And will the programme only be to make policies? No, the whole point of Open is not just to make policy or to make policy recommendations. It's to provide a platform to learn from each other, to work together, to support each other, to then translate that into national initiatives, and to perhaps even influence research, etc. So it does have a remit that is not as narrow as simply to make policy. And then finally, when will Open propose the first steps for the EU? Yeah, well, the next steps, part of the next steps would be to develop a published strategic action plan that would have a time frame around it. And so watch this space, but also we will continue to very quickly and very actively communicate with all coalition partners and with everybody who has taken the time to join the webinar. So they were quite brief answers, but as I've said, everybody who has been involved in the webinar, and especially those who have asked questions, we will follow up with directly afterwards, once we've all recovered from the huge amounts of champagne that we've had in this European Parliament reception. Virtual champagne, which is probably the safest kind to have. So I think now that we've run a few minutes over time, I'd like to take this opportunity to thank all of you for participating in the webinar. We hope that you found it of interest, and we hope that you will, if you're not already involved in some way with Open, that you would like to become so. And so we are now in communication via the webinar, and so we'll follow up with you afterwards. I would like to again thank MEP Sant and Ambassador Anderson for their support and for their presentations. I would like to thank everybody who's been involved in the initial stages of the coalition for their time and their efforts, and obviously for all the people behind the scenes, some of whom I'm sitting with, some of whom are remote in Brussels and in other places, for making this happen. A huge amount of work has already gone into developing the call to action and to launching Open, but it's really just a starting point. This is a launch pad, if you like, for the next phases of the initiative. So I'd like to thank everybody sitting in Brussels, Jacqueline and Michael and others, Cherie, etc., in the UK, and everybody sitting here with me in London, and all the supporters as well. I think it's important to recognise that already a number of our partners, both industry partners and societal partners and association partners, have already supported the initiative and supported the call to action. So we'd like to thank you and hope that we're going to be doing some very impactful work moving on. So with that, I would close the webinar. Thank you for your time. Thank you for your contributions. And my personal call to action in this webinar is to keep communicating and to keep working together, because we really must work together if we are going to make a difference in this space. So thanks again, and particularly to those who made contributions in presentations in the webinar. Thank you.